Good afternoon, everyone, and thank you for joining us for today's webinar on how Aquifer supports clinical learning. My name is TJ Pignate, and I am the Account and Sales Specialist here at Aquifer. In today's webinar, we'll start by introducing our speakers, then we'll discuss curricular gaps and challenges, have a brief pedagogy and content overview, and then dive into how Aquifer is and can be used. Following that, we'll discuss next steps, and then of course have a Q&A as well. Finally, I want to introduce, or I should say first and foremost rather, today's webinar presenters. Starting with Dr. Steve Scott, Senior Associate Dean for Education at the Tillman J. Fertitta Family College of Medicine at the University of Houston. Dr. Emily Stewart, Aquifer's Chief Curriculum Officer. Anthony Wilson, our Assessment Operations Manager. And finally, Emily Haddon, our Marketing Manager here at Aquifer. So with that, I'd like to turn it over now to Dr. Steve Scott.
I'm Steve Scott, and along with various roles in medical education over the course of my career, I have worked with Aquifer for about 15 years and currently serve as president of the Aquifer Consortium. So glad you're with us today to learn a little bit more about Aquifer. So what is Aquifer? We are a nonprofit organization. We're dedicated to delivering healthcare education through collaborative development and really interested in high impact virtual teaching and learning methods. I will also say and elaborate in a moment that Aquifer really is the consortium. It is the tremendous group of educators from across the United States and internationally who have this shared mission of advancing health professions education. So a little bit of history. Aquifer, formerly known as MedU, was formally organized in 2006 as a way to capture and to build on the work of developing virtual patient cases and other innovative methods in teaching and learning, and in particular, organized around national curricular objectives. It began actually back in 2000 with a HRSA grant. Dr. Leslie Fall and her colleagues had developed online cases through their work on the grant to teach the National Clerkship Objectives in Pediatrics, initially called Computer Assisted Learning in Pediatrics, or CLIP, for those of you that may be familiar. And over time, that led to the establishment of MedU in 2006. So as we have grown from that time, the consortium now brings together more than 110 healthcare educators from the national leadership of many different national organizations, AIM, COMCEP, STFM, AGS, IMZ, AUR, AMSR, NOMF, PAEA. All of our content is conceived, created, and maintained by this tremendous national group of educators. All of them recruited in collaboration with their national organization. So every case, everything that we develop, every assessment item, every teaching resource is developed and sustained and linked to the national objectives for each of these disciplines. So some take-home points. I just want to underscore, Aquifer is created by educators. It's for our schools, for our students' teaching, learning needs. All of the Aquifer content is developed and maintained by these interdisciplinary teams of educators, and we work continuously to ensure these cases, learning tools, and other resources are up to date. And continues to be exciting to watch this work grow and the network grow as more and more educators join this collaborative team. Most recently, we've expanded the consortium to include some of our professional colleagues from the PA and NP education worlds. So this is just a visual way to look at all of the different kinds of relationships that are partners with Aquifer. Another illustration of the way we collaborate with these different organizations to develop these educator resources and learning tools for students. And also a way to ensure that your students and your institutions really have the most up-to-date and quality content, and that they are learning, and their learning is grounded in these nationally developed objectives. We also are attentive to ensuring these objectives and content are aligned and mapped to other curricula, so our PA colleagues, NP colleagues, and other professions. Aquifer cases themselves, we do have a very intentional pedagogy for how these are developed and delivered. As mentioned, they're developed by these expert faculty, but we really focus on utilizing these cases to develop clinical reasoning, to develop student clinical decision-making skills. We intentionally create these cases to provide rich and detailed scenarios that really mirror actual clinical encounters, so that it creates the opportunity for the student to really feel like they've seen that patient. We know lots of advantages there with regard to retention and application to different and other scenarios. They also model effective communication and include key questions and other ways to assess their progress throughout the case. Also excited to share with you, Aquifer has a really wonderful reach and tremendous impact in terms of the scope and breadth of learners and institutions. You can see here, Aquifer is used by right now about 96% of US allopathic medical schools and about 2/3 of US osteopathic medical schools. We currently also have over 80 physician assistant programs that utilize our cases and resources, and there are a growing number of nursing programs and other international medical schools and programs that utilize Aquifer. Over 1.3 million cases per year currently are completed by students, and again, a growing number of academic contributors from throughout the United States and internationally. So just a couple of other thoughts and ideas about ways that Aquifer can help you in your efforts and your institution. One of the things we know in medical education is people are short on time and resources. And one of the tremendous value pieces of Aquifer is the ability to harness and leverage the efforts of all of these enthusiastic, top-notch educators from so many different institutions. It results in something that is tremendously high quality and really more than any one institution could create on their own. It also creates efficiency for students, providing on-demand resources, asynchronous tools, and feedback as they progress through these cases. Another opportunity is how these cases, because they are based in national curricula and because they cover the breadth of that curricula, can help you meet accreditation standards. Ensuring students are exposed to the range of conditions that are required and providing meaningful alternative experiences for them. And then one other piece of that is the opportunity to provide meaningful feedback to students. Beginning this year, you may have heard there's a formal tool called Calibrate, which provides formative assessments to students, provides opportunities for students to see where their learning opportunities are, and then to collaborate with their clerkship director or teacher in that setting to develop a learning plan that really is tailored to their needs. Again, a very important and meaningful part of being involved in an education program, but also a way to speak directly to accreditation requirements for formative feedback and assessment with students. Lots more to say, but at this point, I'd like to go ahead and hand it off to Emily Stewart, who will tell us a little bit more about Aquifer.
My name is Emily Stewart, and I'm the Chief Curriculum Officer at Aquifer. I'm also an Associate Program Director for the Internal Medicine Residency Program at Dartmouth-Hitchcock Hospital and an adult hospitalist. Our holistic approach to teaching and learning focuses on ensuring health profession students are becoming successful clinicians. We provide clinically relevant learning tools in a manner that supports them where they are in their learning journey. We provide students with clear direction on knowledge gaps and strengths, then give them targeted learning opportunities through Aquifer content, followed by meaningful feedback and effective coaching, all supported by individualized data. We recognize that schools and students feel deeply the pressure of doing well on a standardized exam, and there are many wonderful programs out there to support that aim. But in order to be an excellent clinician, you need more, and you need tools that work together to leverage that understanding when they turn to their all-important test prep material as well. Unlike other e-learning products, Aquifer cases walk learners comprehensively through each step of a patient encounter, from history, physical, and labs, through developing a differential, ordering additional studies, and forming a differential diagnosis, to treating and managing the patient. Throughout this process, core learning objectives are met through meticulously mapped teaching points, such that by the end of the course, all of the relevant national objectives have been covered. The cases provide in-depth, interactive, and engaging teaching along the way, much as you would expect from an expert preceptor, and ask the students questions to check and correct their knowledge before moving to the next step. Students routinely tell us that there is really nothing else comparable out there to prepare them for success on clinical rotations by providing them with the evidence-based clinical care knowledge that is needed to treat their patients. Aquifer cases are rich with real multimedia test results, modeled communication, embedded questions, deep dives, and links to references and more. They are peer-reviewed and continually updated by our expert medical educators on our consortium. Many educators think of our cases as a library of high-quality, standardized patients, easily accessible by all faculty and learners that can be used as you deem appropriate across your full curriculum. Programs often tell us students and faculty consider each Aquifer case a realistic substitute for a patient because they provide access to conditions and scenarios that may not be seen on a rotation due to your patient volume, seasonality, geography, or accessibility. We provide a safe space to practice clinical decision-making skills and access to patients in core conditions that students need to see. Aquifer has a library of over 200 cases, including our new neurology course, expanded clinical excellence case sets, and over 40 sciences integrated illness scripts. If your program is a curricular partner, like over half of our subscribers, you have access to our complete content library. Our curriculum covers the national curricula and supports a majority of core clinical rotations, all of which use the same clinical reasoning and pedagogical approach in order to promote consistent and effective cognitive practice within a supporting and safe learning environment. We partner with NYU and the Betty Ford Foundation to provide cases in surgery, readiness for residency, and substance use disorders. Our clinical excellence course has 50 cases on interdisciplinary topics that are historically hard to teach during fast-paced clinical rotations. To address this, we have case sets that focus exclusively on these topics, and we have embedded curricular threads that weave these key interdisciplinary teaching points directly into Aquifer's core cases. This provides just-in-time learning for our students and allows programs to ensure coverage that feels authentic without adding faculty time. With access to both the case sets and the curricular threads, programs have the tools needed for introducing topics for early learners, revisiting key principles during relevant core clerkships, and building advanced electives. Now let's talk about the integrated illness scripts. At Aquifer, we aim to bring down silos between basic science and clinical educators to create powerful tools for teaching and learning clinically relevant core basic sciences. In collaboration with IMC, we have developed a comprehensive national curriculum and over 40 integrated illness scripts focused on the causal mechanisms of disease underlying common clinical conditions to support cognitive integration. The scripts are accompanied by a range of fully developed activities, easy to implement in the classroom or the clinic, to help your students make the needed connections, drive active learning and bedside teaching discussions, and most importantly, improve their clinical decisions. I will now turn it over to my colleague, Anthony Wilson, to discuss our assessment options.
Hi, I'm Anthony Wilson, the Manager of Assessment Operations at Aquifer. In recent years, there has been a shift in the assessment industry toward using assessment to drive learning, instead of merely measuring it. To that end, Aquifer offers several assessment tools. Aquifer on July 1st, 2023, launched our new formative assessment system, Calibrate. This innovative new assessment tool drives self-directed learning, identifying true knowledge gaps by calibrating knowledge and certainty, and uncovers curricular gaps for faculty. We offer Calibrate assessments for family medicine, internal medicine, pediatrics, and radiology, allopathic, and osteopathic schools, as well as nurse practitioner and PA programs. We currently are developing Calibrate assessments for neurology and geriatrics, and we have plans for sciences, women's health, clinical excellence, and other areas. Additionally, a clinical decision-making exam is available for internal medicine and is included with our internal medicine course subscription. The CDME provides the unique ability to assess your students' individual abilities to apply their knowledge to make the decisions needed to provide quality patient care. The typical evaluations of student clinical decision-making by residents and attendings working with students in a clinical setting are important, but are limited due to the realities of clinical practice. The CDME helps to overcome some of these challenges and provides a way to enhance your understanding of students' skills. Let's take a closer look at Aquifer Calibrate. Calibrate is assessment for learning, as opposed to assessment of learning. Each exam contains 25 to 45 multiple choice questions. Each question includes a certainty rating to calibrate true knowledge gaps. Each question is also mapped to learning objectives and teaching points in Aquifer cases, which cover the national curriculum for STFM, CDIM, COMCEPT, and AUR. Also important, Calibrate assessments are easy to administer and do not need to be proctored, easing the burden on programs. Calibrate is designed to be given twice during the clerkship, early and late, which provides checkpoints along the way. Early assessment will identify areas of strength and weaknesses at the start of the rotation, allowing the learner to plan, learn, reassess, and readjust their knowledge base. This is followed by a late assessment to evaluate areas of growth and ongoing weakness, helping to inform and prepare the student for lifelong learning, as well as the end of the clerkship exam. Calibrate reports are a powerful tool to drive self-directed learning for the student. The students get detailed reports that link directly to Aquifer learning objectives, teaching points, body systems, clinical foci, and cases. Faculty and programs receive high-level views of individual student performance and detailed views of cohort performance for curricular planning. Importantly, we don't include question and answer stems in the reports. Real patients don't come with tidy answers, nor do our reports. Rather, students are encouraged to dive into where their understanding is miscalibrated and develop an individualized learning plan, which is embedded in our system, for how they will address their learning gaps. Optionally, they can share reports with a faculty member or a coach to inform a meaningful conversation during the clerkship. We also are developing a self-assessment question bank so that students can reassess their knowledge along their learning path. Clinical learning experiences are a valuable commodity. Calibrate empowers students to make the most of their experiences and direct their own learning. For faculty and administrators, Calibrate further supports accreditation standards for mid-clerkship feedback and formative assessment, and aligns faculty and students around a common assessment linked to curricular teaching tools, providing objective data to inform meaningful conversations, identify individual students in need of remediation, and identify curricular gaps for a cohort. In short, by developing Calibrate, we've addressed many challenges you all have by providing a high-quality, nationally developed formative assessment system designed for clinical learning.
Hello, my name is Emily Hatton, and I'm the marketing manager here at Aquifer. The versatility of Aquifer allows for many uses. While the surge of COVID pushed programs to rely on virtual learning, Aquifer really has a place in many areas of the curriculum. Let's talk about some of the key ways you might leverage it. While Aquifer is renowned for our support of learners in core clinical courses, programs are increasingly taking advantage of the Aquifer learning system to support training through all years. Starting with preclinical courses, many schools use Aquifer cases and integrated illness scripts to help students prepare for their clinicals, add relevance to basic sciences, and to spark group discussions. Assigning students select cases or integrated illness scripts to prepare at home can provide a great jumping off point for dynamic in-classroom conversations and activities. During core clinical courses, programs use us in a variety of ways. With cases covering the core national curriculum, Aquifer is an exceptional tool to meet accreditation standards, fill in for missed clinical experiences, and help students develop their clinical reasoning skills in a safe space. Another way programs use Aquifer is in their elective years. For example, Florida Atlantic University Charles E. Schmidt College of Medicine offers 2-week virtual rotation electives for fourth-year students in which Aquifer cases serve as the base. This accommodates the time demands fourth-year students face with Step 2 CK, ARIS applications, and residency interviews. And we're also used to help with remediation. Our cases provide an ideal low-stakes environment, allowing learners to practice skills, review lessons, and build confidence in an accessible and, once again, safe space. Many schools assign specific cases to struggling students to complete and sometimes review key sections together in a coaching session. For example, Dr. Elizabeth Stewart, the Director of Medical Student Education and Clinical Professor in the Department of Pediatrics at the Stanford School of Medicine, thinks of cases as standardized patients and structures clinical reasoning coaching around them. She begins by selecting a fresh case that students have not seen, and then she asks the student to outline an initial differential diagnosis based on the patient's age and chief complaint. She then asks them to list out critical details to watch for in the rest of the case. From there, the students work up to a specified page, at which point they write a summary statement combining critical details as well as a revised differential diagnosis before finishing the case. Faculty then review the work with students in a one-on-one session. And we're also used to help link basic and clinical sciences. At Loma Linda University School of Medicine, students across all 4 years use integrated illness scripts in their curricula. During the first block of their freshman year, they learn how to build integrated illness scripts and mechanism of disease maps, and then they use those through the rest of the medical school to explain and or justify differential diagnoses and management. During their clerkships, they refine the maps they made in years 1 and 2, and in electives, they develop new maps to use as references in their upcoming specialty training. Aquifer is adding 4 new components to the learning system for this upcoming year, and all of them will aid educators as well as students. The first, which I'm very excited to talk about, is Practice Smart, a self-assessment tool made for students. With more than 750 questions available upon launch, Practice Smart will allow students to check their knowledge in a variety of ways. They can pull together quizzes from the question bank and work in either study or quiz mode. Study provides answers and explanations after each question, while quiz mode saves the answers and explanations until they've completed the question set. In both cases, each question links to a relevant case for further study. As with all Aquifer content, expert practitioners design the questions to help students become better clinicians. The questions mimic the style a student might face on rounds. The second is the upcoming Aquifer Obstetrics and Gynecology course. On July 1st, 2024, we are releasing an initial case set of 7 to 10 OB-GYN cases, and more are publishing on a rolling basis, culminating with more than 20. Like all Aquifer content, clinicians at U.S. academic medical centers write and peer review the cases, which cover topics recommended by clerkship directors. And the initial case set will cover many topics, including fetal growth restriction, endometrial hypoplasia, and premenstrual dysphoric disorder. Next up is our AI-powered feedback on student summary statements within cases. Students get immediate feedback, allowing you to scale personalized revisions. The AI is trained on our expert proprietary data like validated summary statement guidelines and examples written by medical educators. It's highly rated by students. Nearly 70% rate the feedback a 4 or higher stars out of 5. And it's been tested and refined. We're currently delivering feedback on 1,000 summary statements a day. Rounding out these additions is Calibrate for Neurology, which brings all the benefits of formative assessments mentioned in Anthony's section to the Aquifer signature course, Neurology. Now that you've learned more about what Aquifer can do for your program and our exciting updates for 2024, here are a few next steps you can take. We encourage you to share the All About Aquifer video or this recording with your colleagues and see if they might be able to leverage us as well. You can also request a quote. Our staff would be happy to walk you through your options, whether you're looking to subscribe to one course or to become a curricular partner with access to all of our cases and tools. Or you can set up a personalized call. We would be happy to talk with you one-on-one about the specific needs of your program, and we can even set up a time for you to chat with a peer to discuss Aquifer's flexibility and the way they use it.
Hi, Kate.
Hi, Mallory. How are you?
I'm good. How are you?
Good.
Good. All right. So let's kick us off with some questions here.
First of all, should we say hi to everyone?
Oh, yeah, that's true.
Hi, everyone. Thank you for joining us today.
So I'm Mallory. I am Aquifer's customer success specialist. And this is our wonderful Kate. She is one of Aquifer's relationship managers.
Hi, everyone.
All right. Do we want to jump right in, Kate?
I think we should. And then we definitely encourage anyone to put questions in the chat, and they will be escalated as they come in.
All right. So first, I wrote down some questions here. Are there any customizable features to tailor the learning experience?
Excellent question. Kudos to whoever asked that. There are in Aquifer's teaching and learning system, we actually have what we call a custom course feature. And it allows you, for instance, if you assign all of Aquifer Pediatrics, you can actually copy that course as a whole, rename it for like block 1, subscription or academic year 24-25, and then you can assign a certain block of students to that course, and then make that the data from that course available to select faculty and staff. You can also, and this is actually probably even more interesting, you can also, if you have one or more, actually more than one Aquifer course, you can combine cases from, for instance, from high value care, internal medicine, pediatrics, social determinants of health into a custom course, and have all your reporting and all your monitoring there. And again, only include the cases that you would like, and then the students that you want for each rotation or each clinical encounter for your course. So it's really, really excellent, and it really saves time in terms of monitoring student performance.
Perfect. So that kind of blends into my next question, where institutions can see student reporting, correct?
Correct. Depending on your role allocation.
Right. Okay. All right. Let's check here. Can you provide examples of how other institutions have successfully implemented Aquifer into their curriculum?
Definitely. Some of really excellent examples, especially in Emily Hatton's section that presentation that we just watched. I think one of the great things about Aquifer, and it's important to emphasize, and it's something that I think came clear on Dr. Steve Scott's presentation, is Aquifer was founded by and for educators. And so as an educator, you come to Aquifer and you subscribe to meet the needs of your students and your program. So we have programs that are residencies, for instance, and they subscribe to Aquifer Geriatrics because it's incredibly important for their residents to have full coverage of Aquifer Geriatrics for their residents. And then we also have programs that are what we call curricular partners. And Aquifer's curriculum across multiple courses provides unity in many instances across multiple campuses. And that's one of the things that I think is remarkable about Aquifer, is that it meets the needs of small programs as well as large multi-campus programs, whether they're US allopathic, osteopathic, PA programs, residencies, nurse practitioner programs. We also have a fair number of programs outside of Northern America who subscribe to Aquifer and have for some time. I always take great pleasure in pointing out that we have a program that's subscribed for many years to Aquifer Pediatrics in Sweden.
Yeah, awesome.
Yes.
Awesome. Where can we find some resources in regards to the content for Aquifer?
I would definitely go to aquifer.org. And there on the main page, there's an option to select the courses, and you can look at individual courses there. And each course page, including our partners at WISE, has detailed information about the course board, and then a full case list, along with recommendations for integration and if there are assessment options. So if your focus is solely family medicine, go to familymedicine@aquifer.org and you can review the course. You can also, learn more about radiology and our other courses. And that we will soon have more information about our exciting new OB-GYN course there as well.
Yes, very excited about that.
Very excited.
We did have another really good question. I'm excited to ask this one. What is so special about case-based learning? Shouldn't question banks be all that my students need?
I think that one of the things that I think it's easy to say, oh, you know, buy thus and so and quiz yourself and you'll be ready for that really important test, because those really important tests do matter.
Yeah.
But what matters most is making sure that your students can think properly.
Yeah.
And Aquifer is a tool in an educator's arsenal of tools to make sure that the students learn to think correctly about various scenarios. And I think one of the things that's really important to remember is that, especially if you're an educator who's been educating and teaching for a long time, is that transition to being an effective clinical reasoning professional takes, for some, a fair amount of time. It's a transition, and students need to practice, and Aquifer allows for that safe space. So if you're lucky enough, you can actually assign cases in such a way that the students in their rotation see a condition before they see it on their with a patient, and they go in with confidence. They don't know everything, but they know more than they knew before, and they can
Right.
be ready for that encounter and to learn what they need to learn. And they begin that process of repetition and each time learning. And I think that's what's really, really great about Aquifer, is that it's safe, it's comprehensive, and all the cases are written by and updated by experts.
Yeah, that's a really, you make a really great point talking about, it's not just getting the right answer. It's about learning how to think correctly, which kind of leads me into more of a, my next question regarding the assessments. We had a great question that says, what type of assessments are available, which we did talk about. How are they structured? Are they multiple choice questions? Or are they case-based assessments? Which both, but I just wanted to delve in a little bit more about the assessments and talk a little bit more about how the assessments help students learn how to think correctly rather than just have just the correct answer.
Excellent question. And Anthony went over this a bit in his section, but it's worth reiterating. If you are an Aquifer Internal Medicine subscriber, you have access to a fairly unique and very challenging assessment. It's a summative assessment, but some programs use it as a formative. It's the clinical decision-making exam. And what Aquifer did in developing this is take leadership from the North, our Canadian friends. Key features is very important within the medical community, medical education community of Canada, and Aquifer adopted that and adapted that to the clinical decision-making assessment. And that actually is based on case scenarios, and students are asked to evaluate multiple options. It's very challenging because a lot of students are used to SATs and GREs and those types of assessments where they like to choose among a limited set of options. And the CDME is not like that. It really strives to be a real case scenario. And because it's challenging, it's so challenging, faculty and staff love it, and students find it really challenging, but challenging in the way that helps them learn. And then we also offer Calibrate currently for family medicine, pediatrics, radiology, and internal medicine. And that is, as Anthony pointed out, a formative assessment designed ideally to be administered early and late in a clinical rotation, and allow students to really build, again, in a safe space, an idea of what their strengths are, areas where they might want to do a bit more work. They can share certain aspects of their reporting with a preceptor if they so choose, but it's not graded, it's not scored. It's really designed to be a reflexive instrument, because that's what you're going to do as a healthcare provider. Is you're going to be constantly learning, constantly reflecting, and you need to be able to learn to activate that muscle, as it were. So what's different between the CDME and Calibrate is that Calibrate assessments generally take no more than an hour each. And the CDME, and I think, Mallory, you're going to have to help me with this. I honestly can't remember off the top of my head how long a CDME takes.
They are about 75 minutes long.
Okay.
And to also note that we do give extra time for students that need accommodation. So that's available as well.
Yes. So we have a lot of options. And the other thing and I think this is worth adding on, is that I mentioned the CDME is included with the cost of the internal medicine subscription. Calibrate there's no additional charge. It's included with your pediatrics, your family medicine, your radiology, or your internal medicine subscription, and it will be included in the neurology subscription when that goes live on July 1, 2024.
Correct. And you can find more information, of course, about everything that we're talking about at aquifer.org. There are multiple sections where you can look at our content and also our assessments as well. I had one cool question that I think that we haven't covered before. Does the platform offer mobile access for content for learning on the go?
Yes, it does. Excellent question. We offer for both Android and Apple.
Perfect. Awesome.
Yes.
All right. I want to do just one more here. We had a really great question as well. What might surprise me about Aquifer that you think I should know as an educator? Wicked important, I think.
I think it's definitely worth reiterating. One of the first things that Steve Scott said at the beginning of this presentation is that Aquifer is a nonprofit. I've already said founded by and for educators, but it's really important that people know that Aquifer comes from a place of altruism. Truly, the organization as a whole, we as staff and then the consortium are jointly pursuing this endeavor of bettering healthcare education for students. The drive is not to make a buck. It is to actually help programs create better clinicians. And that's really important to remember when you're out there. And that's where it comes from. It comes from the heart, and it comes from dedication, many, many years of basically a deep love for students, a deep love for learning, and wanting healthcare outcomes to be improved both in the United States and around the world.
Yeah, absolutely. Great answer. Great answer. Love that. All right. I think we can do one more, maybe. What do you think?
I don't know. What do you think? What you got, Mallory? I think somebody's hitting it out on the park of the questions today.
How does Aquifer help varying programs meet their goals?
I definitely think that I mentioned earlier that we have some large subscribers, and Aquifer actually provides unity across many campuses, which I think cannot be underestimated. If you're a dean or anyone else out there, you're like, yes, I need unity in my curriculum across multiple campuses. One would think that it's easy, even post-COVID. It's not easy to achieve. I think the other thing that it does is it allows learners to be successful. I think Aquifer's ability to provide really strong support for remediation cannot be underemphasized. One of the first things I did as an Aquifer employee many years ago was there was a student who actually had failed their radiology clerkship, and part of their remediation plan was to redo all of Aquifer radiology, which I think speaks volumes about the quality of the cases and how our courses are regarded in various disciplinary communities. It's like, if you need to know anything, this Aquifer course will help you. Aquifer provides the foundation for excellent healthcare education.
Awesome. Thank you so much for sharing that, Kate. Appreciate it.
Do we have any other frighteningly sophisticated questions from our audience today?
I don't think so. Just taking a look.
I actually, if I might add one thing, Mal, it's not been asked, but we've talked about Aquifer obstetrics and gynecology. I'm trying not to shorten it. Coming July 1, 2024, we added neurology last July 1. So July 1, 2023, our plans within 18 to 24 months are to bring Aquifer psychiatry out to our subscribers, and we're very excited about that. That work is underway. So we want people to know that we continue to build out our curriculum, and we're very excited about the future.
Yes, and to that point, we also continue to take all feedback that folks give us. We take it very seriously. It's not something that we just ask people to do and sweep it under the rug. We really, really take people's feedback seriously. So if you have any feedback, if you have any questions, any concerns, please feel free to reach out to us. We'll always be happy to meet with you, and we hope that you do.
Thank you. Thank you for hosting, Mallory. You're wonderful.
Yes, right back at you. All right, guys. Well, I think that's a wrap. What do you think, Kate?
I think it's a wrap. Thank you,
All
everyone,
right.
for being with us today.
Thank you so much. You folks have a wonderful day.